Okay. Okay, hello everyone. Welcome back to Dog Q&A. This is number 46, and today we're starting a series on separation anxiety. And with us for the series of 4 videos is going to be Dr. Jesse McClure, who is a local trainer in the St. Charles, Missouri area, and he's going to give us his insight and expertise on separation anxiety. As you all know, or as you may or may not know, trainers tend to specialize in different areas. And this is an area that Jesse really likes and enjoys working with and has a lot of experience with. So I thought he would be a great person to speak to this topic. So let me bring Jesse in and we'll get started. Hi, Jesse. Oh, let me get your camera on. A few things to do here. So we'll make sure that you can hear and see us. Hi.
There we are.
Hello there. How are you?
Good, and you?
Good. Were you able to go on your walk this morning?
No, we got rained out, so it's postponed until tomorrow.
Oh, tomorrow. Okay. Oh, fun. All right, so why don't you, Jesse, give us a little introduction about yourself and your background and your specialties and all of that, all the fun stuff.
Okay, so I assume the link to my website will be in the description, so you can check there for more information. But I've been working with dogs in some capacity for professionally for going on 20 years now. I started actually in the military, working with military working dogs in the Marine Corps. And anybody who's familiar with those programs will realize that what I do now is very different, a very different approach and a very different mentality. The military trainers and a lot of the current police trainers use a lot of aversive methods or a lot of corrections and a lot of force in their training. And that often isn't the best way to go, especially if we're working with an anxiety or aggression. However, that's where I started learning the foundations of working with dogs and modifying and changing behavior. After that, I went back to school to study animal behavior. And I was a little surprised to find that was often done in biology programs. Prior to that, I thought biology was just, for people going to med school, which I didn't want to do. But I got a degree in biomedical science and animal behavior. And from there, and while I was doing that, I was training dogs at the local pet store. I was working at PetSmart as a PetSmart trainer, which is great experience. I think anybody who has an interest in dog training, that's a great way to get started, to get hands-on with a lot of dogs. But anyways, after that, I wanted to dive in deeper. So I went for a PhD in neuroscience and behavior, which was not specifically focused on dogs. We work with humans and lots of other animals. My research was focused on impulse control, impulsive behavior, essentially, and how it related to addiction, both in humans, and we studied lab rats in the lab. After that, and meanwhile, I was still doing my dog training. I was starting to do a little more of what you consider behavioral consulting, working with some dogs that were struggling with normal training or had some little issues. I then did a postdoctoral fellowship, really working with now more with dogs, with the Darwin's Dogs Project, which is now, I think, rebranded as Darwin's Ark, where we're studying behavioral genetics of dogs. So could we trace variation in the genome to variation in behavior? Might there be genes that predispose some dogs to being more or less anxious or even playful or anything like that? I then took a short stint as a faculty at a college teaching canine science. And over the past couple of years now, I've devoted myself full-time to behavior consulting, working with dogs with aggression, anxiety, and issues like that. I did note that you labeled me in email as a separation anxiety expert, which I would never claim. I'm comfortable working with anybody out there who has trouble with separation anxiety in their dogs, but there are certainly other great resources out there. And a lot of my work focuses more on dogs with aggression, dogs that are really acting out in kind of dangerous ways.
So you would be an expert on dogs with fear-based issues,
Yes.
maybe manifesting more in aggression versus anxiety issues.
Yeah. I certainly work with the anxious dogs too, but one of the things I often say is working with dogs with anxiety or aggression, they both have fear or they both have anxiety. Pretty much all aggression comes from some sort of fear or anxiety. But dogs that are aggressive are still, I say they're still actively trying to change their circumstances. They don't like something around them and they're proactively trying to change it. They're doing it in a very unhealthy way, in a way that we don't like, in a way we want to change. But it's in some ways much easier to engage with them. Where if you go to the opposite extreme, you have dogs that are shut down and they're just kind of, think of it as turning inward and they're just not engaging with the world anymore. Those dogs are really, for the trainer, it's superficially a little safer to engage with because they're less likely to, lash out at you with aggression. But it's challenging because the first step is really getting them to re-engage with the world. So the progress is often much slower. Where an aggressive dog, it's intense at first, but often we can make pretty quick changes.
That's such an excellent picture you painted right there of the two different sides of the fear. Now, one thing before we go further is your camera's a little shaky. So are you on a laptop?
Yes.
Is it on a surface that's moving at all?
It shouldn't be.
Okay.
It's on the desk. Maybe my hands were on the desk.
Okay, so just be mindful of that because I want to make sure we get your information clearly and everyone can see it without being distracted because it's so good. Okay, that's great right there. Okay, so Jesse, let's talk about focusing more on the separation anxiety.
Yep.
What are the degrees of separation anxiety that you see? Go ahead.
Sure. I've seen a wide range, and I always worry about the terms and the terminology we use to label behavior. It's much more productive to focus on the actual behaviors. What exactly are you seeing? What exactly are you concerned about? Not only, even among scientists, we struggle with that. Even among experts in dog behavior, we struggle with that. Somebody will say they're dealing with X or Y labeled behavior, and we really want to go back to what are your actual observations. But particularly when dog owners report their behaviors to people like us, trainers, or to the veterinarian, they say, I'm worried that my dog has separation anxiety. And some dog owners they'll mean entirely different things with that. And I again, given that a fair portion of my work is with aggressive dogs, so the even more blatant example of this is with aggression. When I work with dog owners who worry or are concerned about aggression, I've met people who say, oh, their dog is, they'll just have all these superlative words about how aggressive it is and how dangerous and how scared they are. And, it's this monster and they love them, but they're just really concerned about how horrible it is. And I come in and the dog's a little nervous, but there's not actually it's not that dangerous. It's very mild. And on the flip side, there are people who say, well, he's been a little nervous with some new people, and I walk in and there's very severe issues. So the labels get in the way. So separation anxiety, some people will talk about different terms like separation distress, isolation distress, and certainly these all fall under some similar umbrella. But there are dogs that, one of the first things I want to rule out when somebody worries about separation anxiety, is it actually separation or is it FOMO, fear of missing out? I actually have a client right now where they're concerned their dog might have separation anxiety because every time they have to put the dog in the other room while they're there, because there's issues between the dogs that we're working on, when they put one of the dogs in the other room, the dog is whining and scratching at the door, eager to get back out and rejoin the family. And so they suspect that means their dog has separation anxiety. And I ask them, well, what happens when your dog is actually alone when you leave the house? And they don't know. And so my first advice to them was to get a camera. There are actually a lot of them out on the market now, some marketed specifically for dogs, some of the kind of nanny cam styles, but get a camera, set it up, and see what your dog is actually doing while you're not there. I really also recommend having audio recording with those cameras, because there can be a huge difference between a dog that is calm and resting, and a dog that is sitting not moving, but just petrified in fear. And you'll often hear that. It might be whining, or, well, some sort of whining. So having the audio and visual component is important to see what's actually happening. So separation anxiety is certainly not the dog that is going bonkers when you are leaving the house because they want to go with you and they look nuts, and you close the door and you hear them still whining and going crazy. But once you leave, they go find a bed and lay down and go to sleep. That's not separation anxiety. But how does the owner know? Without something like that camera, or sometimes, unfortunately, reports from neighbors,
Right.
we often don't know what our dog's doing when we're not there. There's a lot of variation between that scale of true separation anxiety, where the dog is damaging property. Often one of the key telltale signs is that they'll scratch at or damage the door that the family left through, or other severe cases when the dog is injuring themselves, either, again, through an attempt to escape. They're maybe scraping up their paws or their teeth because they're chewing at things, or it could be self-injurious behavior of excessive, basically what starts as excessive grooming, or things like that.
Do you ever have clients who call you because they think their dog has separation anxiety and you find that they're leaving the dog in the yard? Have you ever come across that kind of scenario? Do you see a difference between the dog left alone inside and left alone outside?
I certainly can. I am lucky enough to say I have not ran into that myself. But obviously the issue there is making sure the dog has the appropriate environment when you're not there. And I would actually also caution them on both sides of this. A dog left outside, I think there's a lot of reasons where, generally speaking and broadly speaking, that's not a great idea. Certainly not a good idea in general, but there's exceptions to everything. This is a little bit of a tangent, so excuse me for it, but I think it's important to highlight the concept that there have been people even in around here who've gotten very worked up about dogs being left out in the yard overnight. And they just immediately label it, that's neglect, that's abuse. I've known dogs, especially the larger, like the Nordic type dogs, the Huskies and Malamutes. Middle of winter, when I lived in Montana, I had a friend of mine who had a Husky. That dog demanded to sleep outside in the middle of winter. It's below zero, 4 feet of snow on the ground. That dog would just go plop out in the snow and sleep there. So it's kind of a tangent, but we need to know what each individual dog is actually comfortable with. And if we're leaving the dog in an environment that's not comfortable or safe for them, then we shouldn't be talking about separation anxiety. We should be talking about giving the dog an appropriate place to be while we are away.
So you often have to address the underlying framework first. Like I always say, let's address the underlying issues first, and then sometimes the problems solve themselves along the way.
Yeah.
And sometimes there's more to work on, but then it reveals what else we need to work on.
Yeah. And that's true of all behavior problems. It's amazing. Well, I'm not going to get into this, but a lot of aggression cases are pain. And it's frustrating that we often don't know when our pets are in pain. Even veterinarians have an extremely hard time of assessing pain in dogs. But it's really heartbreaking where you see a case where we know the dog is in pain because of a few underlying medical conditions that are not being treated. And the vet has prescribed medication that is not being given. And then the owners are concerned about behaviors that are happening. And they want to know how to change them. Treat the pain, deal with the medical issue. So the same, treat the underlying medical conditions, treat the if there are problems in the environment, kind of the husbandry aspect, if you want to call it that, how you're keeping the dogs. If it's not the right environment for them, fix that first.
Yeah, that's a great point.
And that actually kind of, I'm not sure if we want to get into this yet or if you have some other order to go in, but that's a kind of a key part of one of the main treatment approaches for real separation anxiety is getting the dog accustomed to the environment they're going to be in while you're away before you're away. So you set up their room or their space or whatever it is while you're still there, maybe working on the computer, having Zoom meetings, whatever it may be, and your dog is doing their solo time thing while you're still there.
So proactively working on the issue, which is always smart. I think we can do an entire video on treatment and how you work with it. So we'll save that for later on. But it's good to drop little nuggets of what you're going to be talking about along the way. And so going back to when you get your call from your client, my dog has separation anxiety. What are the things you're looking for specifically with behavior to assess whether or not, we'll just use the term separation anxiety for the purposes of this. So to assess the behavior of the dog and what's really going on and whether or not it is quote unquote separation anxiety.
For me personally, and so this is both a lesson in what I look for, but also a lesson to anybody who wants to work with dogs that have issues, open-ended questions. Because as soon as the client calls and says, I'm worried about separation anxiety, no matter how much we try to do otherwise, I have ideas in my head. That brings images in my head, what I think separation anxiety is or looks like. And often those are wrong. So when they say, I'm worried about my dog with separation anxiety, I just start asking questions. When does this happen? What does it look like? Or why are you concerned? And in fact, it's separation anxiety. That's actually probably not the right way to ask it. Like, why are you concerned? Don't worry about it. But getting to what drove them to have those concerns. Because again, separation anxiety by definition is something that we as dog owners will not see. It's hard for us to know about it. So whether that person came to me because their neighbors complained about their dog barking or whining, or they came home and they saw their door was just torn to shreds, those factors really tell me what we're working with. Versus the person who says, well, every time I walk, my dog follows me everywhere when I'm home, always wants to be with me. And when I leave, I can hear him whining behind the door. That's good information, but it's not complete. What I'd like to know is, does the dog settle down? So we kind of already touched on that. Is it just departure? Is the dog just either uncomfortable with the departure or just really wanting to go with you and a little disappointed? Because a lot of times, again, the dog will just end up go lay down and be comfortable. So it's asking a lot of questions. What are you seeing? What are you hearing? Why are you concerned? Is the dog injuring themselves? That should be up near the top of the list too. So basically, what are the actual things? Again, going back to quantifiable or kind of objective observations that they have that lead to that concern.
Yeah, that's such a funny thing I have the same issue. Someone calls me, they say, my dog has this, immediately things pop in my head.
Yeah.
And as you know, over time, you learn that's usually never right. It's usually either much worse or much better, I find. So I tend to try to push those aside and go in blank. But the key, like you're saying, is to get the person to describe it from their point of view, using whatever words they need to, and just interpreting what they're saying and asking those open-ended questions to get the full picture of what they're really trying to communicate. Because clearly something is wrong enough that they called for help.
Yeah.
And if I always say the house has to be on fire for someone, all of us as humans to ask for help. And what is their house on fire in this scenario?
And sometimes I like that analogy. Sometimes the fire is not at all what they reported it was.
Right.
But there was something. I had a very interesting client who was a wonderful family. I really liked working with them. But they came to me. So I'm now in the fortunate position where I get a number of referrals from veterinarians. So this client had gone to the veterinarian with some concerns about behavior, and the veterinarian immediately had them contact me. And what they contacted me for, I don't want to get into it, but they had these specific concerns. And I came out and met the dog and met the family. And I'm like, I was thinking there's what you were concerned about is not at all a concern. I mean, it's just not happening. But then I had to sit there and say, well, what led to this? Why did they contact me? There's something in this family, something in this environment that isn't working for them. So let's figure that out. Mm-hmm. And there's a lot of misinformation out there, which I think feeds this, is that dog owners will label things in a way that they think is appropriate because that's what they hear on certain TV shows. And, you know, so one of my favorites is somebody, their main concern will say, well, my dog's trying to be dominant. Oh. And part of me just wants to say, no, they're not. But I have to say, well, what do you mean by that? What does that look like? What is it that you're seeing that you're interpreting that way? Mm-hmm. So the same with separation anxiety. Even though separation anxiety, I would argue, unlike dominance, but that's a different discussion. Even though separation anxiety is a real thing, when somebody says, my dog has separation anxiety, I still want to have a little bit of that skepticism and say, well, what does that look like? Or why are you reporting that? What's leading you to that conclusion?
You ever have, I see this one, I wouldn't say a lot, but often enough that it's a pattern. My dog broke out of his crate and either injured himself, tore up the tray, yep. Fill in the blank. Do you mm-hmm. see a lot of those type of scenarios?
I've seen a handful of those, and that could be separation anxiety, but it very well could not be separation anxiety at all. So basically, one way of looking at it is kind of a Venn diagram that might be a little overlap with separation anxiety, where if a dog has real separation anxiety that is untreated, you will most likely see those behaviors, breaking out of the crate, damaging the crate. But the fact that you see those behaviors does not mean it's separation anxiety, not at all. Quite a bit more likely that dog just hasn't been properly introduced to the crate, or quite potentially the crate's the wrong size or something else like that. But they haven't been, either the crate isn't appropriate or they haven't been introduced to it appropriately. And there are countless trainers out there who can really help with good crate training. I really like, if somebody's just looking for resources, I really like Susan Garrett's. She has the crate games, which are a wonderful start. Now, while I say that those crate issues do not strongly suggest that the dog has separation anxiety, addressing those crate issues will be an important first or early step in dealing with separation anxiety or preventing it. Because if the dog needs to be crated and they're not comfortable in their crate, that's just going to exacerbate the whole situation. And especially if they hate the crate because they've not been properly introduced, and that you only put them in the crate when you are going away for work for several hours, that's going to feed separation anxiety, because being left alone is the same as being left in the crate, which is miserable for them.
Right. Associations are being built along the way as well. And yeah. And so you mentioned FOMO in dogs, fear of missing out. The big thing in our society now, don't have FOMO. What does that look like for a dog?
Oh, it can vary widely. That's a great question. I don't have any good data on it other than just kind of my anecdotal impressions. My anecdotal impression of it, though, is it's much more vocal. The FOMO, when the dog is in the other room and wants to be part of the party or with the family, is going to be a lot more vocalization right at the door, maybe scratching at the door, but not the intensity. So it's my interpretation of it, or my kind of image of it, is it's a much more excited behavior. It's like, I want to be part of the party, where separation anxiety is not at all like that. Separation anxiety is not excitement to get there, it's panic from being here. And so the body language will be different. The vocalizations will probably be of a different flavor. Yeah, I guess that's about as good of an answer I can have to that.
That makes sense. We have a FOMO dog.
So do I.
He barks when we leave, and then he goes and lays down.
Yeah. Well, mine doesn't mind when I leave. He's used to that. It's like when I'm getting ready for work, I swear it looks like he rolls his eyes and goes lays down. But if I go out and I'm talking to the neighbors and he isn't with me, he's at the window going nuts because he's being left out and because he loves my neighbors. They're like his favorite people.
And so and that just goes to show everybody out there right now, trainers do not have perfect dogs. I don't know why that assumption is there. I feel like we take the worst dogs. Of course, your dog is amazing. But
He is. He's about as close to perfect as you can get, but he absolutely has issues.
Because he's a dog.
Yeah, and one of his big issues is high energy children. He is not good around them, especially if they're on scooters, skateboards, things like that. And we're working on it, but that's part of who he is.
Right. That's a great thing to just throw out there. So we've kind of talked about what separation anxiety is not, as far as, it's kind of a hard thing to sort of point to and say that is separation anxiety, would you say, until you kind of rule out other things?
Yes, I think that's true. But I don't put a lot of weight on, it's going to be kind of self-contradictory. I don't put a lot of weight on diagnostics at the level of determining a conclusion, like yes, it's separation anxiety, or no, it's just separation distress, or whatever. That has very little value to me. There's a lot of value in the diagnostics in terms of let's gather the data, let's even quantify the actual behavior we're observing, and let's deal with that. Whether that raises to the level that somebody would, whether it passes that line where we'd call it separation anxiety or not, isn't that important to me. Is there some behavior there are two factors that are important. One, there's the dog is unhappy in some way or uncomfortable, and the owner is unhappy with what their dog is doing. Those both, if either of those is true, we should intervene and help. So, there's some arbitrary point along a spectrum where we say that's separation anxiety and that isn't, but we treat it all the same because there's some distress coming from separation. Now, there is a question there of at what point at what point can a trainer help with some crate games? What point do you need somebody who's doing more behavior consulting to really do behavior modification? At what point do you need medication? So those are all relevant points along that continuum, but I don't think still don't need to be strict lines.
Right. I think this, just talking about what it is or is not, or what the term even means or doesn't mean, I think this is a perfect segue into your series on talking about this, because now we can, in our next video, we can move into like how you collect the data and what do we do with that and how do we progress to working with this dog and different things. So I think this is a perfect introduction to this term that everyone is clinging to now and what that really means, and I think as trainers, what you're doing is great in taking the word that we hear, but not necessarily assuming things about it and just listening to what the person is really saying versus clinging to the word that they just put out there. Because, they hear things that they think, oh, it must be this, but we need to know what they're really saying. And I think this is a great lesson for our whole society right now. Move past the language, listen to what's behind it.
Yeah, terms are useful, but maybe it's my mathematical mind is that sometimes the way we use terms builds in a rounding error, that there's a lot of things that, there's a range of things that might be called separation anxiety. And as soon as something gets into that range, we label it separation anxiety and assume it's just like all the others. So the terms can be useful as long as we allow for the diversity in that term, as long as we don't assume that separation anxiety is the same in every dog.
Yeah, I had a client once who had a dog who was outdoors a lot when she first got him.
Mhm.
And it was a shelter dog. He was probably a year old, about 90 pounds. And she had a massive yard, and everyone thinks that is a dog's playground. Let me just leave him out there. He destroyed $10,000 worth of an air conditioning unit. Well, fortunately, she was wealthy and replaced it no problem and kept the dog and wanted to work with him. But it turns out that just having him inside with some structure and rules was better and solved the whole problem.
Yep.
So someone might have said, oh, he's got separation anxiety. He destroyed something. I'm
Mhm.
like, well, it might have just been a big puppy with not a lot to do and too much space on his hands.
Yeah.
So, you know, it's important to listen to what's behind it. Okay, what just happened and what's really going on.
And that is, I suppose that's part of my early discussions with clients too, with all behaviors, is there's a lot of, I guess you could call it a lot of what ifs, because they say, my dog did this in this situation. And so that's data, that's useful, that's what we want. And so again, those get the video recording, the nanny cam, the Furbo, one of them, whatever, all these things. But then potentially vary the environment a little bit. Yes, your dog destroyed the air conditioner outside. What if he was inside? Well, if he's destroying things inside, then we're moving closer towards saying we really need to address that. But,
Yeah. Yeah, so maybe in our next video, you can talk more about the data you collect, what's the best way to get it, how can we figure out what's really going on with these dogs when no one's there, or after the person leaves, or 30 minutes after the person leaves, or whatever. And we can talk about like those types of things. How does that sound?
Sounds good.
Okay, so anything else to throw out about separation anxiety?
Oh, there's a lot.
Wow.
But I think we'll cover that in the future.
Yep.
I'm going to cheat and put in a plug for an idea I try to put everywhere, is
Okay.
just the idea that there is help for behavior issues. I think that there are so many people out there with dogs with issues, some severe and some very minor, and there's a lot of mentality that that's just the way it is. And it doesn't need to be. Whether it's separation anxiety, aggression, whether it's severe or whether it's mild, if there's anything that you are uncomfortable with that your dog does, or if there's anything that your dog is uncomfortable with, we can help. The community, there are things that can be done to solve these problems.
Yes, that's such a good point. You don't have to live like this. It can be better. Well, Jesse, thank you so much. This is such good information. I feel like this is a time as we're coming out of the lockdowns everywhere and people are getting out and they're seeing, oh, my dog has been cooped up for a year. Now what? So I think the timing of this is perfect too. So
yeah. And address it before you have to go back to work. And that's what we'll talk about in a future video.
Absolutely. Okay. All right, Jesse, thank you so much. And then we'll do a next week will be video number 2 with Jesse, and we'll get some more information about what to do about this. Now that we're sort of looking at what it is, now we can look at what to do about it. All right, Jesse, thank you again.
Thank you.
All right, bye-bye.